Welcome to the Deep Dive. We're here to unpack a topic that's definitely front of mind for a lot of people right now. It brings both excitement about the future and, let's be honest, some real anxiety.
Right.
The impact of artificial intelligence on jobs in healthcare.
It's a massive question, isn't it? We're hearing so much about AI making things more efficient, maybe even getting, better at diagnosis.
Yeah.
But if you're a doctor, a nurse, an administrator, really anyone working in that system day to day, the big question is, okay, cool tech, but what about me? What happens to my job?
Exactly. And that's really the core of what we're tackling in this deep dive. We've been looking at excerpts from a book called AI in Healthcare, Augmentation Over Displacement by Dr. Sora Bhatia. Now, the title itself gives a pretty strong hint, doesn't
It
it?
definitely signals a perspective.
That we want to dig into the sources and really see, what do they actually say about AI's role here? Is the goal truly to replace people, or is there, a much more nuanced story?
Well, let's jump right into that because the sources start with a really critical disclaimer. They make it absolutely clear that AI tools in healthcare are intended as aids.
Aids, not replacements.
Precisely. One source is very firm on this. These tools are not meant to take over human judgment, diagnosis, or treatment. It's not about removing the human element. It's about equipping it better.
Okay, that's a key point to start with. So if it's not about replacing, what is the main idea running through these sources then?
It's all about augmentation. That's the word you see again and again. AI is framed as being designed to augment or enhance human capabilities.
Augment, so like
Yeah.
giving healthcare professionals extra abilities, superpowers almost.
You could sort of think of it that way. Think of AI, as these sources describe it, as a really smart assistant. It could act as a vigilant guardian, maybe offer personalized mentorship, or even be like a safety net weaver, always working alongside the human. There's even an advertisement phrasing highlighted in the book that captures it pretty well. AI empowerment. Not replacement, but enhancement. That choice of words is deliberate.
Empowerment, not replacement. Okay, that framing makes sense, conceptually. But how does this augmentation actually work on a practical level? How does AI step in without just taking over?
Yeah, good question. It primarily seems to do this by tackling the administrative stuff, the time-consuming processes that often, bog down healthcare professionals. The core benefit that keeps coming up is freeing up their valuable time and resources.
Okay, so it takes away the tedious parts so people can focus on what really matters, patient care, complex decisions. Can you give us some examples from the sources? Where does this automation show up?
Absolutely. They point to things happening right in, say, outpatient departments, like automating smart appointment scheduling or maybe using AI for initial patient triage.
Right, things that take up a lot of phone time and coordination now.
Exactly. Those tasks consume a lot of human hours. And it's not just patient-facing stuff either. The sources also talk about automation happening behind the scenes in hospital operations.
Like what?
Things like optimizing the supply chain, predicting maybe staff allocation needs for different shifts, or even predicting when a piece of medical equipment might need maintenance before it breaks down. Workflow efficiencies, basically.
That's interesting for the operations side. But what about the core clinical roles? Doctors, nurses, specialists. How does AI augment what they do directly?
Okay, yeah, this is where it gets really interesting for the workforce itself. A prime example given is AI-powered voice-to-text documentation. We all know healthcare providers spend a huge chunk of their day just documenting patient interactions.
Oh yeah, the charting burden.
Exactly. Manual notes or even traditional dictation methods can be slow, cumbersome, and sometimes error-prone.
Which pulls them away from actually talking to the patient.
Precisely. So the AI solution described here transcribes their spoken words in real time. It even learns from the user's voice to get more accurate over time.
So the doctor just talks, and it appears in the electronic chart.
Pretty much. The workflow described is the physician speaking their notes, observations, whatever, and the AI software instantly transcribing it into the EMR, the electronic medical record. The doctor then just needs to quickly review and sign off.
And the benefits?
Well, the sources list significant ones. Saving time, drastically cutting down the administrative load, and allowing them to refocus on actual patient care.
And there's a pretty striking number about the time savings mentioned.
There was. Physicians using this kind of AI reportedly saved an average of 2 hours per day on documentation tasks.
2 hours. Every single day. That's huge.
Think about what that time means. It's not just disappearing, it's being redirected. According to the sources, that time can be put back into spending more quality time with patients, perhaps seeing more patients, or even just reducing their own workload and burnout. That's explicitly mentioned as a benefit for job satisfaction.
Hmm,
It really highlights how AI could potentially improve both efficiency and professional well-being, at least according to this view.
that's a powerful illustration of AI directly helping a professional's workflow based on these sources. Anyway, what other examples did they give?
Another good one is automated medical coding assistance. Medical coding assigning the right codes for diagnoses, procedures. Based on clinical notes, it's essential for billing and records. But traditionally, it's manual, very time-intensive, requires a lot of detailed review.
And accuracy is absolutely critical there, right, to avoid claim denial.
Exactly right. So the AI here helps by automatically suggesting relevant codes based on the transcribed notes or the clinical documentation. The sources even include a little anecdote. A task that took, say, 30 minutes manually was completed in under 5 minutes with the AI's help.
Wow, another massive time saver. But, okay, what does that mean for the medical coders themselves? Is the source suggesting they're replaced by this?
And this is really key to the whole argument. The sources frame this not as replacing coders entirely, but as empowering these professionals. It lets them work smarter, focus their expertise on reviewing the AI's suggestions, handling the really complex cases, ensuring accuracy rather than doing all the initial repetitive coding.
So the human expertise is still vital for validation.
Absolutely. And they list the financial benefits too. Reduced errors mean fewer claim denials, faster payments, lower overall costs. The human oversight is presented as crucial.
So the pattern seems pretty consistent across these examples. AI handles the routine, the time-consuming, or the data-heavy tasks, freeing up the human professional to be more effective.
That's definitely the narrative coming through from these sources, whether it's generating draft discharge summaries or maybe monitoring patient data after they leave the hospital to catch complications early, or even automating parts of clinical trial monitoring to free up research staff. The consistent goal presented is using AI as this sophisticated assistant. And the benefits highlighted circle back to the same core ideas: time savings, less burden on staff, improved accuracy, and enabling professionals to focus more on patient care.
You mentioned this collaborative vision.
Yeah.
Is that reinforced by specific examples like in pathology?
Yes, that's a great illustration they use. The future workflow described isn't the AI replacing the pathologist and diagnosing slides all by itself. No. Instead, the AI analyzes the slides first, maybe flags areas of interest, generates an initial report.
Okay.
Then the human pathologist comes in, they review, they validate the AI's findings using their expert judgment, and they issue the final authoritative report.
So they work together. The AI does the initial heavy lifting, the analysis, and the pathologist applies their expert judgment for the final call.
Exactly. And the sources are very explicit about this. One quote says, AI is not a replacement for pathologists, but a powerful tool that can augment their expertise. And this collaborative model seems to be the blueprint the sources advocate for across many areas where AI gets integrated into clinical work.
Okay, so the sources really push this augmentation idea hard. But, we started this deep dive acknowledging the anxiety about job displacement. Does the book just gloss over that fear, or does it actually tackle it?
No, it absolutely acknowledges it. It's not ignored. While the emphasis is heavily on augmentation, the sources aren't painting this picture where there are no challenges. The potential for job displacement is explicitly identified. It's listed as an ethical consideration and a significant challenge that comes with integrating AI into healthcare. It's definitely on their radar.
So they see it as a real concern that needs to be actively managed, not just wished away.
Yes, exactly. And the sources propose specific ways to address this potential downside. First, they call for responsible AI development and deployment, making sure the tech is designed with these human impacts really considered from the start.
Which ties back to that core message of augmentation.
It does. They forcefully reiterate the need to focus on augmenting rather than entirely replacing human capabilities. And this is where they emphasize something crucial: providing training and support for healthcare professionals to help them adapt.
That makes a lot of sense. If roles are changing, maybe less time on certain tasks, more on others, or needing new skills to actually work with the AI, then helping the existing workforce gain those new skills is essential, isn't it?
It's about upskilling and reskilling, helping the workforce transition into those potentially new augmented roles. They also reinforce that in healthcare especially, human judgment must always have the final say.
Right. The buck stops with the human.
Precisely. And this inherent need for human oversight, particularly in complex diagnostic and treatment decisions, acts as a kind of natural buffer against outright replacement in many key clinical roles.
It really sounds like the future envisioned in these sources requires very careful collaboration, not just between humans and AI, but between everyone involved in the whole healthcare system.
That's absolutely the vision put forward. The sources talk quite a bit about the need for strong collaboration between the technologists building the AI, the clinicians on the ground who understand the real-world needs and challenges, and, crucially, policymakers who set the rules, the regulatory framework.
Policymakers are key here.
Very much so. They're highlighted as a key audience who need to really understand the ethical, the regulatory, the societal implications to guide responsible and equitable AI adoption.
So minimizing negative impacts like potential displacement isn't just up to the tech companies or the hospitals. Policymakers have a vital role in shaping how this technology gets integrated responsibly.
Precisely. The sources see policy as essential for ensuring informed decisions that support beneficial and fair integration. They also touch on, practical factors influencing success, particularly in the context of India, which the author focuses on.
What kind of practical implementation challenges do they mention?
Things like user adoption, making sure the healthcare professionals actually use the AI tools effectively, doing a proper cost-benefit analysis, and really important, effective change management within healthcare organizations to help people adapt to new workflows.
Yeah, that's always huge.
They also acknowledge challenges like a potential skills gap among some staff and the need to adapt training for varying levels of digital literacy. These are real-world hurdles.
It's not just about having the fancy tech. It's about the people, the training, the systems around it.
Exactly. And there's an interesting contrast, the sources point out, related to job fears. While the book clearly acknowledges the professional concern about job displacement, it also references findings from something called an ABDM study likely related to India's digital health mission. That particular study, as cited, apparently didn't explicitly list job displacement concerns as a primary barrier among the general public when they were surveyed about digital health adoption.
That's quite a difference. It suggests maybe the anxiety about jobs is felt much more acutely by the people working in healthcare than by the general population, who might be more focused on, say, access to care or efficiency.
It does highlight potentially different perspectives, doesn't it? And it maybe underscores why the sources focus on addressing the concerns of the workforce, particularly through training and support, is presented as so important.
So, stepping back, if we look at all these sources together, the dominant message seems to be that AI in healthcare is being presented, first and foremost, as a tool for augmentation. The main aim described is offloading those tedious administrative tasks.
Right. It's about freeing up healthcare professionals to do what they frankly do best, applying complex judgment, providing empathetic care, building those human connections, focusing on the really nuanced aspects of medicine that AI, just cannot replicate.
Yeah. And while the potential for job displacement is acknowledged, it's seen as a real challenge and an ethical consideration. The sources strongly advocate for a strategy centered on responsible AI development, making sure the tech augments human roles, and crucially, supporting the existing workforce with training to help them adapt to these new AI-enhanced ways of working.
That really sums up the core message from the material we've looked at. The vision presented is one where AI boosts efficiency, reduces burden, improves accuracy, all with the ultimate stated goal of enhancing both the quality of patient care and, importantly, the work lives of the professionals providing that care.
It paints a picture of AI as a powerful partner in healthcare, rather than sort of the replacement people might fear.
Based on these specific sources, that's certainly the clear direction and the stated intent.
So what does all this mean for you, the listener, as you think about this topic? These sources strongly suggest that the future of healthcare will be highly intelligent, it will leverage AI. But the explicit goal laid out here is for that intelligence to empower, rather than displace, the dedicated professionals providing care.
Which does leave you with a compelling thought, doesn't it? If AI successfully takes over many of the routine, time-consuming tasks, what new opportunities might actually arise for healthcare professionals? Could it lead to entirely new kinds of roles, maybe allow people to expand their expertise in ways previously limited by just lack of time? What does that future really look like?
A great question to consider as this technology continues to evolve. Thank you for joining us for this deep dive into AI and healthcare jobs. We hope this exploration of the source material has given you some valuable insights.
Thank you. And we look forward to diving into another fascinating topic with you next time on The Deep Dive.